All right, thank you for being on today. And today I want to use the whiteboard and address an issue that I've seen many times, but it manifested itself in my practice recently. So it's top of mind, and I think it's relevant to anybody, whether or not you have Crohn's disease, which we're discussing today. But more important than the diagnosis is the approach that we're going to be discussing. And so recently I had a family of three fly in, I should say, from Missouri for care. And all three family members, the mom, the daughter, and the son, have been diagnosed with Crohn's disease. And believe it or not, all three of them received the exact same treatment from conventional medicine. And, so if we look at conventional medicine's treatment of these three different people, all with the same diagnosis, they all get the same treatment or one treatment. And that treatment has been Humira, which is the biologic medication that, if the algorithm ends up at Crohn's, then the next algorithm is, well, what do we give Crohn's? It's Humira. And so these three different people, one is mom, one is daughter, and one is son, they all are receiving the same treatment, even though there's different genders here, there's different ages and different periods of life. And so hopefully, even if you're someone out there seeing this with zero background in medicine or health or anything, hopefully, three people getting the same treatment should seem wrong to you, because I think we're at a place in society where we understand enough about health that we realize, hey, we're all individuals. And unfortunately, the medical system hasn't caught up to it yet. But my bias is that everyone should be addressed as an individual and receive an individualized care plan. And I want to show you why today with this family as our case. So, like I said, each of them has been diagnosed with Crohn's disease. So we'll give them that. All right. But what's interesting is if we say over here, we can say Crohn's mechanisms. I talk about in my book in chapter 3. The book's called The Autoimmune Answer on Amazon if you haven't seen it. But in chapter 3, I talk about Crohn's disease as my avatar for gastrointestinal autoimmunity. And in there, I talk about there's three different mechanisms for triggering Crohn's disease. Okay. One of them is autoimmune. You could have an autoimmune triggering of Crohn's disease, which includes antibodies, et cetera, the things that we expect to see in autoimmunity. There's autoinflammatory Crohn's disease, okay, which includes inflammasomes, which is a big nerdy word we can talk about. And then there's gene plus virus or viral trigger. Okay, so in the person with the gene plus a viral trigger mechanism of Crohn's, they have a genetic susceptibility that does not damn them to Crohn's. It increases their susceptibility to developing it, but that gene must still be expressed. And the expressing agent or the triggering agent is a virus in that person. Okay, so again, before we go any further in trying to determine what kind of care each person should get or what kind of treatment in the medical model each person should get, it's well established in the scientific literature that Crohn's has three different triggering mechanisms. So if we have three people with Crohn's, they shouldn't necessarily all get the same treatment right off the bat, because you don't even yet know which of these three or combination of these three triggering mechanisms are involved in each case. And that matters because addressing autoimmune disease is different than addressing inflammasome activation, which is different than addressing viruses. So again, there's nuance here that if we're just using a pharmaceutical algorithm to say, well, what pill should we dispense once we know the name of this person's suffering, we we can't help the people the way that they should be helped. So again, the thing that is similar between these three is that they are family and that they all have been diagnosed with Crohn's disease. But then we get into differences from there. So with mom has also reported that she has what's called exertional dyspnea. Exertional dyspnea, which is basically shortness of breath, or when she tries to exercise or go up a large flight of stairs or something like that, she can't breathe well. Okay. And so we've talked about before, if you are lacking oxygen, that's pro-inflammatory, because if you don't deliver oxygen to cells well, they're going to send up an inflammatory signal flare to basically say, hey, breathe or die. Okay. So mom has that, and she also has episcleritis, which is inflammation in her eyes, or in the sclera, above the sclera of her eyes. All right. So she also has insulin resistance, so blood sugar issues. Okay. Now daughter has Crohn's, like we said. I should change the colors of these people so that it's different. So daughter has Crohn's. Daughter has also been diagnosed with type 1 autism, which is formerly been known as Asperger's. Okay. So Crohn's disease is one thing, then you layer on autism, that changes the game a little bit potentially. And then also she has insulin resistance, blood sugar issues, and she also has hyperuricemia, which is a nerdy term for high uric acid in her blood. But that will come back around here to be important in her case in a little bit. And then the son has Crohn's. The son also has chronic sinus infection, to the point that when he presented in my office, he had scabs around his nostrils and a little bit of blood, because it's that bad of an infection that is just raw, and it's been there so long that the dermatologist is now at the point where they've recommended 3 months straight of antibiotics to try and knock it out, and they say that it's a staph infection. Okay, and the son does not have insulin resistance. Unlike the other two, the son actually is on the hangry spectrum, which would be his blood sugar gets too low too fast. Okay, so the opposite of insulin resistance. And so there's other things that are going on with these three. One unifying factor is they all are iron deficient. They all have iron deficiency, to the point that before they came in, the mom actually recently had an iron infusion to try and head that part of it off. And that the iron deficiency in her case is likely tied to some of the shortness of breath, because again, if you can't deliver oxygen, it's going to be hard to breathe under exertion. And it's going to be hard to be able to go long in exercise or go long in physical activity if you can't oxygenate tissue and cells. So iron deficiency in all three is going to definitely be partially due to the Crohn's, because Crohn's disease is destruction of the GI tract where you bleed. And every time you bleed, you lose iron. And so heavy bleeding, leads to heavy iron loss. And then in the ladies, both menstruating, they're also losing blood monthly in their menses. So iron is a big piece of the puzzle here, and in any puzzle if it's deficient, because in order to heal from Crohn's disease or from diabetes or from a hip replacement surgery, you have to be able to make energy. And if you can't make energy, you can't heal. So you should start, or your practitioner should at least assess your energy systems, because again, if we're chasing something sexy like Crohn's disease or diabetes, but we leave an underlying iron deficit and we can't make energy, how can we heal from that sexy thing, right? Because we don't have the energy to allow us to heal. So again, here it is laid out for you. We have 3 people with the same diagnosis, which is Crohn's disease, but we have 3 people with 3 very different cases. And so then if we go and we say, let's change colors to purple here to label the different mechanisms of driving Crohn's. Okay, so mom's is autoimmune. She's got antibodies that, 80% of Crohn's have what are called anti-Saccharomyces cerevisiae antibodies, and she does have those. Daughter is going to be autoimmune and autoinflammatory. So she's got the ASCA antibodies, and she's got the high uric acid, which high uric acid suggests autoinflammation or inflammasome activation. And what the heck is that? Well, so when you're inflamed, you can have extracellular inflammation or inflammation outside your cells, and you can have intracellular inflammation or inflammation inside your cells. And inflammasomes are what set off the inflammation inside your cells, and that sets off auto-inflammatory disease. Auto-inflammatory meaning self on fire, right? Whereas autoimmunity is shooting self or attacking self, immune system attacking self. So the daughter has a combination mechanism for her autoimmune disease, and the son also has a combination. He has autoimmune because he's also got the positive ASCA antibodies. And then I suspect that he may have gene plus virus activation given his history that I'm not going to go deeply into today. But chronic infection has been a piece of his history that is not as much a piece with the others. And so it's possible that that is also a contributing mechanism. Autoimmunity definitely is, and is sufficient in and of itself to drive Crohn's, but there may be some gene plus virus interaction as well. So again, if we've got 3 people, same diagnosis, but 3 people with 3 different triggering mechanisms, then giving all 3 people the same medication isn't going to address their issues evenly, right? It might be great for one of them if you get lucky, but the other 2 aren't going to get where they need to go. And in reality, it hasn't been great for any of them. That's why they're flying across the country to get help. But and just driving it home further, say the Humira did help one of them a lot. That's great that it helped the Crohn's. And in so doing, let's say for mom, let's say the Humira helped a lot. So that would help the Crohn's, and, so be like, hey, we're doing better here. And if we help the Crohn's, then hopefully she's bleeding less, and it also helps the iron levels. But Humira is not going to do anything for her blood sugar and insulin sensitivity. It's not going to do anything for the episcleritis necessarily, unless the episcleritis is a TNF-alpha driven episcleritis in her case. But the point is, we have to address the whole person, not just the Crohn's disease, right? The Humira won't do anything for the autism in the daughter. Okay, so even if it helped the Crohn's, the autism still needs to be addressed. The blood sugar still needs to be addressed. The Humira won't do anything about the high uric acid in her, so that would still need to be addressed. And then the kid or the son, of course, you have to address the chronic sinus infection. You have to address the blood sugar in addition to the Crohn's, or else they don't get as healthy as we want them to be. So wrapping it all up, we've got 3 Crohn's cases. They all get the same treatment from medicine. None of them get the health that they desire, and they continue to suffer for years. Okay. And a good example of this is all of them have had the disease diagnosis for years, and none of them had had a stool test. And one of the major things we want to look at, so mom thought she was okay because she has Crohn's disease, but she says, well, I don't see any blood in my stool, so I'm fine. But none of the doctors had ever run a stool test to look for what's called occult blood. Okay. There's two types of blood you can have in your stool. There's obvious blood, which, you defecate and you turn around and you look in the toilet and you see red blood in the toilet. Okay. And then there's occult blood, which is blood that's in the stool, and it's occult or hidden, meaning the bleed is typically somewhere higher up the GI tract, and the blood has been in the GI tract so long by the time it comes out in your stool that it's lost its redness. It's no longer visible to the naked eye. So mom tells me before we go over her labs, yeah, I'm doing good. I don't see any blood in my stool. I never really have. Well, we ran an occult blood test, and her occult blood was 3 times higher than normal. So she began to cry. And, why did she cry? Well, because this was a test that's simple to do, never been run by any of her previous doctors. And she thought she was better than she was because she's never seen blood in her stool, when in reality, she's got 3 times the normal level of hidden blood in her stool than she should have. And why does that matter? Well, because she's bleeding, basically invisibly, and that drives losing blood, causes you to lose iron. Losing iron affects your ability to breathe, right? And affects your ability to think, because all of our neurotransmitters require iron, or to think, to have emotions at all, any of that, all your neurotransmitters, you need iron. So knowing whether or not a person is bleeding in a hidden way is very important, especially in a disease that is known for bleeding. Okay, we also looked at hidden blood in the daughter. Okay, her occult blood was worse than mom's. Her occult blood was 10 times higher than normal. Okay, so again, she's iron deficient, losing blood at 10 times the rate of mom. She's got autism, and we just said we need iron to make all of our neurotransmitters. What do you think neurotransmitters are involved in autism at all? Absolutely. Okay. Do you think oxygenating the brain is important at all in autism or in any individual? Absolutely. So this is a big fail by the conventional medical system to have not looked at this test in these people, especially given a disease where bleeding is a known part of it. And again, the daughter could never see blood in her stool either. The son, we looked at the occult blood and he didn't have any. So that's good for him. And that suggests he did not have any. So 0. That's great for him. It suggests his Crohn's is maybe more under control than the other 2 in his family. And so his stool test did reveal, though, that he had multiple different species that are pro-inflammatory and potentially pathogenic overgrown, which is called dysbiosis. So again, 3 people, same name disease, 3 different cases. Mom and sister bleeding heavily in a hidden way in their GI tract, which needs to be addressed and suggests that Crohn's process is very active. Whereas he has no hidden blood in his stool, suggesting Crohn's maybe isn't as active, but he's got a lot of dysbiosis or microbial imbalance in his gut. So maybe his gut symptoms are more due to the microbial imbalance than it is from the Crohn's disease process at this time. So again, wrapping it up, we don't, when you're in conventional medicine, if you're out there and you've got a diagnosis that you've been suffering with for a long time, and you've seen all the specialists and no one can help you, it might be because the paradigm is wrong. It might be because conventional medicine isn't looking at you as the John or the Jane that you are, the unique individual that you are. They're looking at you as the Crohn's disease diagnosis that they gave you. And that's the secret sauce or the poison, if you reverse it, is that if they stop looking at you as an individual and they only look at you as Crohn's, they don't look at the rest of these factors that potentially matter. They just say, oh yeah, there's John or there's Jane, and we give this drug to Johns and Janes with that diagnosis, and see you later, you're out in 7 minutes, have a nice life. Whereas functional medicine says, Crohn's, that's interesting, but that's not happening in a vacuum separate from the rest of John or the rest of Jane. So, I'm keeping that Crohn's disease obviously pinned in my mind, but I want to zoom out and say, that's not happening in a vacuum separate from the rest of you. So what are the other sticks in your spokes physiologically? What's blood sugar look like? What's gut look like? What's thyroid and hormones and sleep and relationships and finances and stressors? There's many factors. So if you're out there and you haven't been helped, no matter how many quote unquote specialists you've seen, it's probably because the specialists and the system is too myopic, and that's zooming in on one part of you and not looking at you as the whole you that you are. So you probably need someone to zoom out and look at the whole case as a whole to best help you achieve a life at optimal.